Hey guys, welcome back to podcast number 3 of the non-surgical spinal pain relief with Dr. Cassidy Boelk. I am Dr. Boelk. I'm a local doctor of chiropractic and a certified spinal decompression doctor here in San Diego. And I've been practicing for the last 22 years, helping people get out of pain without drugs, injections, or surgery when they're having disc issues. Today's episode is how do I know which treatment to choose for my herniated disc? In the last episode we talked about can a disc heal on its own, and the answer to that basically was in some cases it can, and in other cases it may not. There's various different factors that might depend on that. For a lot of people, if they recently been told you have a herniated disc, one of the first things you're going to notice is everyone's got an answer or a solution for you, right? One person's going to tell you, oh, I had that, you got to rest. Another person's going to tell you, go to physical therapy. Oh, you got to go see my chiropractor. Go see my massage therapist, right? My sister's brother's gardener, rubbed arnica cream on their back, and it did it 3 times a day, and it went away. And so the problem is there's so many different variables, and it's not a one-size-fits-all for everybody. And some people obviously have done surgery, and they're telling you need to do surgery. So the most common question I really will get for people is, how do I actually know which treatment makes sense for my herniated disc? And that's what we're going to go over today, because a lot of people, you're going to be overwhelmed. It's confusing. How do you know which treatment to do? And it can be just a daunting process in and of itself. I've hurt my back in multiple different times. I still play some old man adult beer league hockey from time to time, and been known to have some contact, even though it's a non-contact league. I still surf and lift weights and work out. But initially, I had broke my back when I was 16 years old, and which was a extremely painful thing to go through, both physically and emotionally. And I've learned a lot from that. So a couple of things to go through today. The first is kind of the big idea. Not every herniated disc is going to be needing the same treatment. Some patients will come in. As a matter of fact, yesterday we had a patient that came in, and she originally got referred to me, and I asked her yesterday, well, hey, how did you get referred to me? And she reminded me, she had told me that she was in the MRI center and she was getting an MRI, and she was having this horrible sciatic pain. And one of my long-term patients was there. She was just getting a follow-up MRI, and she happened to mention to this person about my office and the treatment and how it's basically made a huge difference for her, and she's still able to play tennis. And this is my patient Ruth, which I love to death. And Ruth is, I want to say she's early 70s and still very active playing tennis and doing extremely well with that. I think she just won like the doubles contest in a high league. Anyways, regardless, this patient was in so much pain that she couldn't get into the clinic. So she called, and she had a huge disc that was compressing on her nerve, and she was getting a little bit of what's called saddle anesthesia, where she's getting numbness in her pelvic area, which is really a red flag. Number one. Number two, she had just had a baby, and a baby involves a lot of bending forward. So she asked if she thought I could help her, and the short of that was I didn't think I could. I thought due to her situation, the factors and the compression, she actually really did need surgery at the time. So she underwent the surgery. She did fairly well with that, and then her pain returned doing some therapy and some rehab, and it really caused her to have a lot more symptoms. And then she came in, long story short, she's done some decompression with me. She did very well, and now she just kind of comes in for some maintenance from time to time. But that's just an example of, it's not a one-size-fits-all. Just because you have a herniated disc doesn't mean spinal decompression is going to be the best treatment for you. That's why we have a very thorough analysis. So kind of the better question is not just what's the best treatment for a herniated disc. The better question is what exactly causing this pain, and what would be the matching best possible solution. In her case, it did involve surgery. In many cases, it doesn't. Why do we get confused? So a lot of confusion is going to happen because there's so many treatments that can help somebody maybe temporarily feel better, but it doesn't necessarily mean they're addressing the cause, right? So a good example of that is an injection. Someone might do a spinal injection or cortisone injection, and they feel like a brand new person for a week or two, and then the pain maybe comes back, or they get relief for maybe 3 or 4 months. The disc is still compressed, and then they go out and they're playing volleyball or they're playing golf, and they recompress the disc. Their tissues are not very strong or stable, and now they're back into horrible pain. And then they're going, well, I tried the injections, and maybe they've tried therapy before, and maybe even they've done spinal decompression. We have a ton of patients that have been to other offices and have done spinal decompression and didn't get the results they were looking for. Well, not all decompression is the same. There's pre-therapy, there's post-therapy, there's the settings during. So it's very unique and individual for each patient. And just like a personal trainer, they're not all the same, or a restaurant's not all the same, right? It's a little bit more to that. So we really need to understand what is actually a herniated disc, what's it actually doing, right? To have the proper treatment, we need to understand what actually might be going on, right? So when a disc becomes injured, or it bulges, or it herniates, what exactly is happening with that disc? Well, as the disc compresses and the pressure builds, essentially what's going to start happening is those fibers in that disc, the outer ring, they're going to compress more and more. And the more they compress, the more chance they have to herniate or push outside and onto that nerve root. And that really is typically the source of most of the pain. Now, obviously, there are some cases where you're going to have some pain localized only in the back. But for a lot of patients, as that pressure increases and builds, you can get that sciatica pain down the leg. It can be pain in the buttock, numbness, burning, tingling, weakness. All of these things we're gonna see. So when we're evaluating, and when I'm evaluating a patient, what I'm really trying to figure out and differentiate, is this more of just some inflammation that's going to maybe settle down on its own? Is it more some instability? Is it more muscular? Is it tight? What a portion of this would be coming from the disc, if any, because obviously each person needs to have a specific treatment, and there are other healthcare professionals that I will refer to depending on what's happening with that individual. However, if the disc is the major driver of the pain, and we think that the compression is causing the muscle tightness and causing the instability, then that's a little different conversation. And that may be a patient we're going to treat with the decompression, and then the very specific rehab and therapy afterwards dependent. So again, a lot of this is going to be varying from person to person. And number one, and number two, the sequence is extremely important, right? What's the difference between salad and garbage? Well, it's timing, right? Nobody wants to eat soggy lettuce, but if the lettuce is crisp and nice, I enjoy a good salad as much as anyone else. So what we're really looking for is the goal should be matching the treatment to the problem. And so there's different jobs for different things, right? If the disc is compressed and we need to decompress it, we need to calm down the inflammation, great. If there's a lot of instability and that person's really, really weak within their core, within their glutes, then we need to strengthen that. If they're really stiff and tight and their range of motion is extremely poor, we need to work on that. So, the answer really is, what is the best treatment for me? Well, you might have an MRI and you might go through that and chat GPT what's going on. You might have referrals from a doctor to go do physical therapy, and depending on that therapist, they may or may not have the same level or expertise of knowledge that someone who treats disc all the time would have. So I would really tell you, regardless of what type of herniated disc you have, it would be really good for you to potentially see somebody that really has evaluated a significant number of these type of cases, and someone who is not going to treat every patient the exact same way, right? We see a lot of that, a lot of cases. We actually had a case 2 weeks ago that got referred in to me from another doctor, and this patient had seen a doctor prior to that one who wanted to do decompression and told her she's going to need 25 treatments and it's $10,000 later. It turns out she was not even a candidate for decompression. She has severe osteoporosis with a very high risk factor for spinal fractures. The last thing we want to do is incorporate decompressive forces, which is going to put a lot more stress and strain on that area and potentially cause a major issue for her at that point. So all that to say, you really want to see somebody who you feel good and you trust, and and sometimes maybe getting a second or third opinion is not a bad idea either. So at the end of the day, everyone's going to be specific to what they're happening for them, and the treatment itself needs to be tailored to what's happening for them. So really what we're looking for is proper evaluation, proper treatment protocols. You could have patients that come in that have a very similar situation. So let's say, for example, they have a herniated disc. It's about the same in size. It may be the same. They may be the same body weight potentially. They may need very different treatment protocols. Maybe the table needs to be open. Maybe it needs to be closed. Maybe they need a 15-minute treatment. Maybe they need a 45. And this person may be ready for therapy 2 weeks or 3 weeks after initial decompression. Another person might not. They may need daily treatments, where someone else maybe needs twice a week. So these are just all examples of specificity and being very direct with each patient and setting up a plan that works for them, that's not just the same for everyone going through. Okay. Where does the decompression kind of fit in? Why is it helpful? And why do we use the equipment that we use? Well, we use DRX 9000 tables. The reason why we use that, in my opinion, they're the best tables that there are on the market. They have the most research. They are built the very, very best. Can you still get relief with other machines? Absolutely. There's great practitioners all around that can really do a good job with still some of that equipment. So that being said, we want to make sure that whoever you see and whatever equipment they use, they're very knowledgeable of what that equipment can do and what it can't do, and they're specific for each person. Essentially what's happening with decompression is this. Typically with most of our patients, when they come to see us and the disc is compressed, obviously in the disc there's two main components. Number one, the discs are what we call avascular, and that simply means there's no direct blood supply, right? You cut a finger, it's going to bleed, heal, no big deal. Well, discs don't work that way. They really need to rely on proper motion. So normally all day long that disc is going to compress and then it opens, and this is called spinal imbibition. Let me show it to you. When we have that disc, essentially what's occurring is the disc is going through all day long a little bit of compressive forces, and then it's opening. And that motion, it's called spinal imbibition. It allows that disc to receive water, oxygen, and nutrients, right? So it can thrive. Well, the problem is with most of these discs, well, all of the discs, they don't have that blood supply. So they need that proper motion, number one. And number two, the disc is typically degenerated, and when it's degenerated, what that tells us is the oxygen content within that disc is very poor. So typically we would call them kind of hypoxic discs. They don't really have a lot of oxygen content, and so the decompression is helping by pulling that pressure off of that disc. So it's compressed, and it's slowly pulling the pressure off to get that water, oxygen, nutrients back in there and allow it to go through that spinal imbibition, which allows the disc to stay nice and healthy. The pressure comes off the nerve, the pain can go away, and then we can be very specific with the type of therapy that we do. Okay. That being said, there's a lot of talk these days, and a lot of patients will ask me about stem cells. And unfortunately, stem cells for a disc aren't the best, because stem cells need two very important things. They need blood flow, right? And they need oxygen. And the discs don't really have much blood flow. Well, they don't have any. And they don't really have much oxygen, especially just that are degenerated. So typically most stem cell injections that you put into a disc aren't really going to do a whole lot. Those stem cells that were injected into your disc are typically gone and sloughed off and dead within, typically days to weeks to months for sure. So it's one of those things where I don't know that that's going to make a big difference for somebody. Now, PRP injections, those kind of things can be extremely beneficial. We had a patient that came in yesterday. I hadn't seen him in a couple of years. He did extremely well with decompression, but we did get him to a point where, we told him that, listen, you're 75% better. I don't know that I can get you the rest with just decompression. And so I actually referred him to a local doctor here in San Diego, who did a great job, and he did some PRP injections with him, and that helped him a significant amount. And now he's kind of, it's been a year and a half, and he told me he should have been coming in for his maintenance, but he got busy with life. Long story short, some of that pain is coming back. we're going to decompress him, and that probably make him feel a heck of a lot better. So again, this is just an example of we're going to work together with who we need to send you to. Physical therapy, chiropractic, surgery, sure, absolutely. There's certainly situations that need those different type of treatments. I'm a licensed doctor of chiropractic myself. It's very uncommon I'm going to adjust somebody, because the adjustment is really not going to help that disc, and in most cases it's going to make it probably feel worse. So really, a simple way to think about it, if you can ask a few questions, right? What's actually causing my symptoms with this herniated disc, right? Is the pain feeling like it's more inflammation? Is it muscular? Is it compressive? Is there nerve involvement, right? And sometimes these are difficult questions to answer for yourself, so that's why we typically need to make sure we see somebody that knows exactly what they're doing, okay? What I see most often with people is they're doing way too many therapies, way too many stretches, way too many exercises, and they're really overdoing things, and then they get discouraged because it doesn't work. So we really need to be specific and clear with the treatment. Just as important as what to do is what not to do as well. So if you've been diagnosed with a herniated disc and you're trying to decide what you want to do, I would say don't just choose the most popular treatment or what your brother's friend is doing. Really try to think about the problem a little bit more. Try to understand really what's causing your disc, and seek out somebody that would be neutral in that they're not going to treat everyone the same. And if someone's not a candidate, they're not going to try to treat them even when they shouldn't. So if you're here in San Diego or you're even elsewhere, we have patients that come from different states and fly in to see us, and you've been told you have a herniated disc, you have sciatica, a bulge, compression, you're not sure what to do, give us a call. The office number here is 619-298-0800. You can schedule a no-charge consultation. We'll sit down and see if we might be able to help you get rid of this pain without involving drugs, injections, or surgery. So take care. Hopefully this was helpful. If you have any questions, go ahead and send a message, and I'll be happy to do my best to answer those. And we will see you guys next week. Have a great day.